Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here with my guest, Deborah Dugan, CEO of Beyond Type 1. Deb, thanks for joining me.
Oh, thanks for having me.
All right. So you lead this amazing, dynamic community called Beyond Type 1. If you're in diabetes, you know all about it. If you're not, you might not be as familiar. So tell me about Beyond Type 1.
Yeah, I mean, we're sort of a media platform wellness movement in the space, which is really needed. So we have the largest digital imprint with over 5 million that follow us, but we do big swing campaigns like to help people get diagnosed that reach 150 million because we engage influencers and celebrities and sports figures, and we figure out ways to get to the underserved in really unique ways as well with our health equity efforts.
How did you get into type 1 diabetes?
Oh, I have a crazy story. So I worked with Bono in the AIDS fight, and we
I've heard
did,
of him.
in working on his humanitarian work, we did something called Product Red, which was, there's a world crisis. How do you get people to know about it, to care, and to be engaged, especially the youth-minded? And so we had a brand called Red, and we had Apple, Starbucks,
I remember.
Salesforce, Microsoft, you name it. All of the most iconic brands helping with a world crisis. That raised $650 million for the Global Fund in the fight against AIDS, but most importantly, it raised awareness. So post-COVID, where 500 million people are affected by diabetes, another 500 million are pre-diabetic, and 40% of the COVID deaths worldwide were attributed to your autoimmune and diabetes in particular. So again, world crisis. Is there a brand that can make a difference? Celebrity is Nick Jonas and his wife Priyanka Chopra, Nick has co-founded Beyond Type 1. He had Type 1 diagnosed when he was 13. Priyanka is a UNICEF ambassador, so she cares so much about world health. They called on me and said, we'd like to burst
those worlds kind of came together.
Beyond Type 1 into breakthrough, innovative brand in the space.
Okay.
And I think that energy is needed.
Yeah. Talk to me about what you've learned through the community. You hear all these voices every day. What do you hear about what people suffering from type 1 diabetes, they desire through the platform?
Yeah, I mean, it's so interesting. The biggest call is community, that you are not alone.
Okay.
So that affects everything from how you manage your health, to knowing the latest technology, to knowing how things work, to getting the right information and education. But then the peer-to-peer is just huge. It's a community that wants to help each other, that wants to know when you're diagnosed that you're not the only one going through this. And so we try to give tools to survive and then thrive. Like, how are you going to live your best life? And then as a community, how are we helping each other do that together? And that community reaches far and wide into India, into Africa, and to places where we're needed most.
That's awesome. So part of the reason why we're having this conversation is you've been a big supporter of our T1D Moonshot community, helping to really lift up some of those innovators. Where do you feel like we are in the innovation life cycle within T1D?
I think it's exploding. We're here at a health conference, and the TD1 Moonshot is the talk of the town. I mean, it really is, because it affects so much. And we were lucky to spend time with the innovators that are part of the StartUpHealth Moonshot. And each one has such a unique perspective and is just cutting through in ways that needs to happen. And the fact that they're all collaborating with each other is game-changing. And that will change the trajectory of the
Obviously, you don't want to have favorites, but is there an area of innovation that you're particularly excited about?
Well, of course, AI. And being able to see the patterns of your health and take agency of your own health is going to be a huge breakthrough when everything comes together. When it's your exercise, what you're eating, what's happening all throughout your day, being in one place, easy, and that's our goal, is to just make living with this disease easier, but also giant steps towards cure. Like
Sure.
you just see it, and you feel that there's
On the
an
biopharma,
explosion.
on the...
You know, I'll just be honest, Logan, and tell you that the call to entrepreneurs that you're doing is exactly what has to happen, and more people that are out there with just a little gem of an idea that sees something, approach in one domain, and thinks perhaps we could put it over here in the type 1 world. That is going to just be the answer. And certain people that I talk to, and you're right, I'm not going to say favorites, but one person was, oh my God. And then when I got it, and when I saw it, Deborah, I can't sleep at night. And that person deserves the resources, the attention. We want to hold them up and say, look what's going on over here. It might not be the answer, but it might. And just, you know, generating more and more from those ideas and having them brought together with StartUpHealth, it's just an innovation that is going to change the world and the landscape for type 1.
Isn't it interesting and exciting to see this happening within type 1 diabetes, which has had a history of people innovating for themselves? There's been this groundswell, this movement to innovate for your own children, your own life.
Yes, it's like a lack of tolerance for a system that is not working for them.
Yes, so there's been
so
a
we're
DNA.
going to go around the system. We're going to hack the system.
Yeah.
We're going to find out ways that work. We're going to find ways to get cheaper insulin. We're going to find ways to...
We're not, what's the term? We're not waiting or something?
Complacent. You're not complacent.
Yeah.
It's like, you know what? It's a... You know, not an evolution. It's a revolution.
This is my life.
This is my life.
I'm going to take
and
control.
it's going to get better fast.
Yeah.
And you know what? It is a unique community. And I think that when it bands together, and I feel like at Beyond Type 1, we have an army.
Yeah.
We have an army that's not going to wait.
Yeah.
And so if we can tap in and help you in any way, find new entrepreneurs, and then take those that are onto something and hold them up high so they get more financing, so they get to the next level of their research. It's just fascinating to me.
And what's also special about this community is that for us, it's a new model. We've got this moonshot community that we're replicating in other areas, and yet it's a really special place to start because of the cohesiveness and the innovative spirit within type 1 diabetes. And then for us, our goal is to replicate that collaborative spirit in other areas and then see how it kind of builds on itself.
Everybody's watching you, and it's working.
That's awesome.
It's working. Everybody feels it, and you're right. It's going to be the model of how it will work better in the future. And again, with AI and the explosion of looking at those patterns of data, you know, having things at your fingertip lets you be more human. Lets you have more time to live your best life, to talk one-on-one with your doctor, because the data and everything else will be in the background and just easier to access, and you'll be able to, you know, get diagnosed in the first 100 days, manage your condition better, so that you have more quality of life and live longer.
Well, Deborah, thanks for taking the time with me.
Thank you,
Beyond
Logan.
Type 1 is an essential advocate in this market, and you know, helping people tell their stories, connect with one another, know they're not alone, and now you're leveraging that to really push innovation in a bigger way. So,
and together we've just begun.
Yeah.
It's very exciting, Logan. Thank you for
thanks
having me here.
Thanks for stopping by.
Thanks.